So POLARIX was a randomized Phase III double-blind clinical trial in which patients with advanced diffuse large B-cell lymphoma were randomly assigned to receive either the standard therapy, which is R-CHP, chemoimmunotherapy, or the investigational therapy, which was R-CHP, Polatuzumab, vedotin, plus everything that's in R-CHP minus the vincristine. And the trial was double-blind in that patients didn't know whether they were getting Polatuzumab for real or vincristine for real. It was one of those two, but patients and physicians did not know which treatment they were getting. And so that was the design of the trial. There were more than 800 patients enrolled, and the primary endpoint that was looked at to measure the efficacy was called progression-free survival, and then there were other endpoints measured as well. The results of the trial were that the Polatuzumab R-CHP regimen improved progression-free survival compared with R-CHP, and it improved a number of other endpoints, including what's called event-free survival. It reduced the need for additional therapies because patients relapsed less commonly, so that patients in the Pola R-CHP arm needed less second-line chemo, less stem cell transplantation, less radiation therapy. There was not a difference in the overall survival. So those were the primary efficacy endpoints of the study. And then in terms of toxicities, it really was quite similar to R-CHP. The side effect profiles of the two regimens were not terribly different. It really did not seem to add much in the way of additional side effects or significant side effects. In fact, there were it seemed to be a little bit more deliverable than the R-CHP in terms of dose reductions and things like that. So overall, I think the trial is going to be deemed a success. It's important because it's been 20 years since we made a change in the standard frontline therapy for diffuse large B-cell lymphoma. It's been about that long since it was shown that adding rituximab to CHOP improved outcomes, and since then many a trial has failed to improve upon the outcome seen with R-CHP. So this is really the first of its kind in a couple of decades, and so it's really exciting to see an improvement here in the outcomes for patients. So.